U.S. health officials are shortening the recommended time for COVID isolation and quarantine. The CDC now calls for anyone with COVID to isolate for 5 days instead of 10. That is, if they don't have symptoms, and CDC additionally recommends wearing a mask for 5 days after that quarantine period. CDC is also similarly shortening the time that close contacts need to quarantine. This all comes as COVID cases surge across the country. Joining us with more are Dr. John Segretti, Medical Director of Infection Control and Prevention at Rush University Medical Center, and Dr. Rachel Rubin, Senior Medical Officer and co-lead at Cook County Department of Public Health. Doctors, welcome back, both of you, and thanks for joining us. Dr. Segretti, let's start with you. Please give us a sense, if you would, of what hospitalizations are currently like at Rush.
The number of people admitted with COVID is definitely going up, and it has been for the last 2 weeks or so. And we're seeing more people in the intensive care unit. What's interesting is that while we're seeing a fair number of vaccinated people being admitted, very few of the people in the intensive care unit have been vaccinated or boosted. So it does seem like people who are the most severely ill are the ones who are not vaccinated and not boosted.
And doctor, are you expecting to see a rise in hospitalizations after, this past weekend's holiday gatherings?
Well, I think that that's something that we've seen in the past, and I expect that we'll see some uptick in number of cases. How much, no one knows, but I suspect that we'll see more cases on top of the surge that we're experiencing already.
Dr. Rubin, would you say Omicron is the leading variant in the majority of cases right now, or is Delta still leading the way?
From what we can tell based on the statistics from the CDC, it looks like that the new cases that we are seeing now are predominantly Omicron. In terms of what we've been able to document in the state of Illinois and especially in the Chicago area, we don't really quite know yet. This is certainly what we suspect, but because only a very small percentage of the positive cases, the specimens are genotyped for the type of virus that individuals are being infected with, we don't really know yet. But we certainly know that if Omicron is not the predominant variant in our area, it will be very shortly.
Dr. Segretti, how would you describe the impact of the ongoing staff shortage right now, especially as we're seeing healthcare workers themselves being infected amid this surge?
Yeah, I think the big difference with this surge compared to surges we've had in the past is that in the past we had a shortage of resources because there were so many patients. This time, even though we're not seeing as many patients as we did in March and April of 2020, we've got fewer staff. And so it really has been very challenging because of the number of people, the number of staff that have gotten sick.
Now, as we mentioned, the U.S. Centers for Disease Control and Prevention just updating the guidelines that people who test positive can exit isolation after 5 days if they don't have symptoms and if they continue to wear a mask for 5 days post-quarantine. Dr. Rubin, what is Cook County currently recommending for people who test positive?
At this point, we haven't announced whether we will be in sync with the latest CDC guidance, though we usually are in lockstep with them. But we need to wait and see what the Illinois Department of Public Health puts out for their guidance for the local health departments in our area.
Okay, so it sounds like the guidance not decided yet, obviously, and I'm sure we'll be hearing from those departments going forward. But what do we know about the Omicron variant, Dr. Rubin, that might support this new guideline and what this new guideline could be based on?
Well, the guidelines, I think, are based on the science as we know it up to now, which is that especially with Omicron, that it's highly contagious. You can get it quicker. You don't have to be exposed to somebody for quite as long before you get it. Also, for those individuals that have been vaccinated, individuals tend to get very mild and maybe even asymptomatic cases of it. we tend to, it's also been shown that when somebody is symptomatic means that they probably have what's called a higher viral load, and they're more likely to be contagious and infect somebody else that they may come in contact with. But if they have no symptoms at all, waiting that 5-day period, but remember, it's not just 5 days of isolation they're recommending, it's also an additional 5 days where that individual wears a mask at all times when they're outside of their home. So putting those two things together most likely will keep individuals safe. And in terms of the quarantine period, that again means that if you are not vaccinated, it's recommended that you maintain that quarantine for 10 days, if at all possible. And if it's not possible, again, you have to be very strict with your mask wearing. And if you've been vaccinated and you're a close contact but have no symptoms, so therefore you don't seem to have an active case of COVID, you're also likely not going to be infecting somebody else.
Now, Dr. Segretti, South Africa and the UK, we know that they were hit by the Omicron wave before the US. They've begun to report that their hospitalization rates have started to hit their peak. At what point do we think the same could happen in the U.S., or are we expecting the situation to worsen in January?
Well, if the past is any predictor of the future, what we've generally seen is that as the number of cases goes up, and then 1 to 2 to 3 weeks later, number of hospitalizations and deaths start to go up. Again, the rate at which hospitalizations and death have gone up in those countries hasn't been nearly as steep as the rate of cases. So we're hopeful that we're not going to see an overwhelming number of people who end up in the hospital or end up dying. But I do think that we'll see a lot more people get infected, probably through January.
Dr. Rubin, what practices do you advise for people as we approach the weekend New Year's celebrations?
Well, as you're aware, we, as well as the city of Chicago, my health department covers the majority of the suburbs, is that we've put out a new mitigation order that won't go into effect until after New Year's. That being said, anything that's in that order is very important for individuals to make the right choices. And so what that means is we are not recommending that people congregate in large settings with large numbers of people, especially with its unrelated people outside of your own household where you're not sure of anybody's vaccination status. So we're recommending not to have large New Year's Eve celebrations, even though they are not going to be mandated as being prohibited. So that's one thing for sure. Always wear your mask, especially when you're with people who you're not unsure whether they're vaccinated and they're not part of your household. Wash your hands, try to maintain that physical distance of at least 6 feet or more. And these are all things we've been saying all along, especially since the summer when we have had an indoor masking order that everybody indoors needs to mask whether they are vaccinated or not. The problem is that when you have a large gathering and people are eating or drinking and they are dancing,
I'm sure
potentially,
people
that's a real issue.
They begin to forget, of course. We'll have to leave it there, and best of luck, and of course, Happy New Year to Dr. John Segretti and Dr. Rachel Rubin.
Thank you.
Thank you very much.